COVID has made the situation even worse because we've seen obviously the Anganwadi workers and all were busy, trying to help the COVID situation. How much has it pushed this nutrition issue further?
It has actually pushed it back quite a bit because, and especially when things were beginning to revive a little bit, Anganwadi centers were opening, we had the second wave. And like we know, the second wave was much worse and spread to the rural areas than even the earlier time. And therefore, there was, of course, that crisis of health, which everybody, the service providers as well as the families were facing. But over this last year and a half, we've had Anganwadis closed, schools closed. Although there has been a policy that children should still continue to get the supplementary food in the form of either dry rations or cash, that's been very inadequate. And field surveys show, for instance, the Right to Food campaign, we did a survey in about November 2020. We found that less than 50% of the children who were eligible for the supplementary nutrition were actually getting anything. And even those who were getting it was not regular every month. It was kabhi beech mein ek baar aa gaya kind of thing. So the food is...
Sorry. Even cash is something, the children, you really don't know how much they'll benefit, maybe the parents.
Yeah, because so even cash, like I can give you an example of Delhi. For the whole month, a school child would get around 120 rupees. Right? So that didn't really translate into one meal a day. It goes into the family pot. It's so difficult to even go to the bank and bring that money out in the middle of lockdowns and curfews and so on. So services have been disrupted, not just in terms of food distribution, but Anganwadis do so many other things. They do growth monitoring, they do counseling. All of that has not happened for a year and a half.